Hello friends, this is Subit Bagun and I welcome you all to the brand new episode of Sex, Only Unique Formula for Happy Life. Friends, whenever we face any medical or health related problem, what we usually do? We share that problem with our family or with our friends, right? But whenever we face any problem which is related to our sexual life, we don't share it with anyone. Rather, we try to hide it. And for this reason, we have started this special sex education show called Sex, Only Unique Formula for Happy Life. Friend, this is one of its kind platform where you all will be able to share your questions related to your sexual life and Dr. Vijay Dahifale will solve your problem in very positive manner. But before starting the actual talk, let us all know about Dr. Vijay Dahifale in detail.
Dr. Vijay Dahifale is very famous sexologist, urologist and andrologist. He has his clinics in Aurangabad, Hyderabad, Delhi, Dwarka Sector 23, Pune, Nerul in Navi Mumbai, Dadar, Andheri, Kalyan, Nashik, Ahmedabad and Dubai. Dr. Vijay Dahifale frequently travels in India and abroad for seminars and conferences related to sexology.
So friends, now that you all know about Dr. Vijay Dahifale's various clinics, we have a good news for you that Dr. Vijay Dahifale has recently started his new brand clinic in South Mumbai and that too in Kulaba area. So you can definitely visit his Kulaba center and take his consultation. We have doctor here with us. Doctor, welcome to the show.
Thank you very much, Smith.
Doctor, we are speaking about sexual dysfunction and you have received lot of questions on your personal WhatsApp and also on your personal email ID.
Yeah, sure.
And we also have received lot of questions on the videos that we put out on various social media platforms and people want to know scientific information about sexual dysfunction.
Yeah.
So in this particular topic, you have selected one very important topic, that is different types of breasts.
Definitely.
So sir, my first question to you is, what are half-fed breasts?
Excellent. Sumit, in this series of sex education, sexual awareness and sexual safety, we are saying these different topics, different shapes of a breast, different shape of a penis, different shape of a vagina, and very shortly we are going to see different shapes of a testicle. Why we are saying this different shape of a breast? Friends, we must know what is normal, what is abnormal. Because when we see in our clinic during follow-up, after marriage, those partners living with each other, they have a complaints with them with their shape of breast. The problem we are facing in the foreplay also. But when they are complaining, when they are coming with the partner, now you have to tell in details about different shape of a breast which are normal. Because we are giving this scientific information in our one frame, especially time, place, person, condition, culture, safety and consenting. In this frame only we are going to utilize this knowledge for your own and known partner. I feel half-fed breast you are asking.
Right, half-fed breast.
During motherhood, when there is a feeding going on, see, mother is feeding the child. And one-sided feeding is over. What happens? If the baby's stomach is full, baby go for a sleep. In that time, other breast is already full and it start leaking. But as baby is sleeping, he cannot suck on that side. So for temporary purpose, at that time baby go for sleep and in that time it looks like unequal. But friends, it is not permanent, it is temporary.
Okay.
Again next time when baby awakes and he sucks on other side, again that breast become empty. Why we are discussing this? Because one must know this type of variation also occurs when these mammary glands are full. The shape increases, means we want to give this message. And when the mammary glands are empty, the shape again goes back to normal. And this phenomena is totally physiological, acceptable, and after 6 to 8 to 9 months, it again come back to its normal shape.
So sir, are there any different names for these half-fed breasts?
Yes. Half-fed, half full breast, there are half empty breasts also. The breasts which are unequal also for temporary purpose. And the breasts which are not comfortable, means when they are wearing their coverage, these upper garments, it is looking as up and down. So depressed and elevated breasts. So this only is for the purpose of description. This nomenclature for the purpose of understanding by line of treatment, by methodology, or what line of treatment we are giving later on. It doesn't matter with each other. So only for the purpose of knowledge, we are given these different type of names.
Definitely, sir. Moving on, I have a
Sure.
few more type of breast
Yeah,
that I would
definitely.
like to ask you about.
Yeah.
But can we have one call?
Sure, sure,
Yeah.
definitely.
We have
You can
Akshay
have it.
from Fort Navi Mumbai. Akshay, you can ask your question to the doctor. Your phone is now connected.
Hello.
Yeah.
Hello.
By giving massage to the breast increase size of the breast.
Yes.
Okay.
This is again a very common doubt. People come to me, sir, my partner is having very small size of breast. Due to that, I am not getting so much of interest in the foreplay and all. So then, suggest me some of the good oil. With that oil, I will do the massage and they will become larger. No, these are some misconceptions. Different type of advertises, different types of some presentations they have seen on some different social medias. So oil are just lubricants, just they soothes the skin.
Okay.
Or any type of some, you can say moisturizer, they are just moisturizing the skin. Ideally, what contains the breast material? These are the glands, mammary glands. Unless and until they are properly developed, there doesn't occur the shaping of the breast. And especially if you want to increase the breast, visit to specialist, sexologist, urologist, and andrologist, buying the cosmetic surgery. By using different types of breast implant, we can enlarge the size of the breast. So friends, remember only one thing, with oil or any type of massage, you cannot increase such a breast size to a larger aspect.
Definitely. Sir, moving on, what are Roald Dahl's, I hope I am pronouncing
it's
it
Roald Dahl's.
correctly,
Roald
Roald
Dahl's,
Dahl's type
correct.
of breast is.
Yeah. Basically, these names are somehow funny,
Yeah.
but why there are some mnemonics or Italians or other names they have
Okay.
given, Roald Dahl's, twits. It's like a twitting. You can say the breasts are outward and upward. Means
Okay.
on the shape of nipple they have decided. So such type of breasts which are twitting, means they are looking upwards. And these are also called as a normal breast and which doesn't create any problem with the breastfeeding, doesn't create any problem with the foreplay also. But when that partner looks towards that, they look something different than others, so they feel it as abnormal. But friends, don't take it as abnormal. If you have a doubt, meet the specialist, clear it, and if a purification is required, definitely by consenting of each other, you can go ahead with the cosmetic treatment also.
Definitely. Sir, so what are the different names for this Roald Dahl's breast?
But from where I get these names?
Yes.
Upward going
Okay.
nipples, laterally facing nipples, yeah, upward looking breast. Such type of different names they are given. When I come to know the couple sits in front of me, sir, I am having such type of some tiny upward looking breast, and what I observe or when I have seen in my knowledge, they are not like this. Whether they are abnormal, they will create any problem for feeding, nothing else. We have to counsel these people. We have to explain them. We have different books, unique formula for happy life.
Yes.
In that these all details are given.
Right.
So friends, don't take any doubts. Any type of change which is expected, any type of shape which you expect, then can be done very nicely with cosmetic surgery.
Definitely, sir. We have one more caller, and also
Sure.
we have Anjum from Bhopal. Anjum, you can ask your question to the doctor. Your phone is now connected.
Hi, sir.
Hello.
Happy marriage anniversary, sir.
Thank you very much. Yeah.
Sir, whether breast implant can be performed if pregnancy is supposed to plan in future, and whether it affect on breastfeeding.
Excellent.
All right.
It's a very common question. Now, see, the first child they are achieved. Then now, after 2 to 3 years, they want to plan the pregnancy. But with first pregnancy, by feeding and by this all activity, breast become lax. Now they want to perform the implant. Yes, definitely they can perform. Because why? By putting in the implant, it doesn't affect any type of pregnancy at all, because their location is pre-pectoral or behind the pectoralis muscle. So it doesn't affect any way to the mammary glands. And due to this, even after pregnancy, even after delivery, for the feeding purpose, there is no problem, because our breasts are behind and mammary glands are ahead. So there is no problem in feeding, no problem for pregnancy, or no problem for any foreplay later on also. So very safely they can undergo breast implants with the hands of experts, specialists, sexologist, urologist, andrologist, and cosmetic surgeon.
Definitely, sir. Moving ahead, what are fought hard as hell type of
Yes.
breast?
Fought hard as a hell.
Yes.
Just for description purpose it is made.
Yes.
Means what? Sometimes due to some reason, due to absent mammary line,
Hmm.
one breast is totally normal and other breast is absent.
Hmm.
It can be congenital also.
Okay.
Sometimes what happens, there may be a fibroadenoma, means any tumor in the breast, any type of malignancy, a carcinoma. In that cases, they have to remove the breast as far as possible. They try to preserve the breast tissue, but sometimes such a condition comes where you cannot preserve such type of breast. There you call fought as hard, but you cannot preserve. So one side of breast is absent
Okay.
and one side of breast is present.
Okay.
Such type of breasts are called as a fought hard as a hell, but still we cannot survive them. But don't worry, these are also treatable.
Definitely. Sir,
Yeah.
so then what are different names for this type of breast?
Yes, unilateral breast,
Okay.
one-sided absent breast,
Okay.
yeah, vanished breast.
All right.
But not to worry, because with using skin expanders, what happens directly in such a flat skin, you cannot put the implant. Using skin expander, due to expansion, first match the lateral side, collateral side, then put in an implant. Then you can do areolar reconstruction. Then you can do nipple reconstruction. So friends, only remember one thing. Whatsoever is the shape of breast, whatsoever is the size of breast, don't be unhappy. With the treatment of specialist, we can give a required shape. Definitely, you can enjoy your married life happily with your partner, with consent, and by putting in our cultural frame.
Definitely.
So friends, any problem, you consult with sexologist, urologist, andrologist and solve your all problems.
Definitely, sir.
Yeah.
Thank you so much for sharing all this valuable information.
Sure.
But due to time constraint, we have to stop here in
Yeah.
this particular episode. But definitely, we will meet in
We'll come
one
back.
more episode.
Yeah.
Well, friends, you can also take Dr. Vijay Dahifale's consultation. There are various contact details available right on your screen. And there is a good news for you that Dr. Vijay Dahifale has recently started his new brand clinic in South Mumbai and particularly in Kulaba area. So definitely, you can visit his Kulaba center and take his consultation. Well, friends, it's time to stop here. Thank you so much.